just to kind of start off, has anybody here, just raise your hands, has anybody had any personal experience with palliative care? See one. Not many. So that's pretty common. We often, maybe somebody's heard of palliative care, or they've had some family member that's been involved in it, or a friend, or they've heard of it, but not a great understanding of what palliative care is, how we can be helpful. So I think that's what we're going to try to work on today, is giving you a better understanding of our services, because if you search the internet, that's not necessarily a great resource. This is just an example of doing a Google search of palliative care. You'll see 6 images here. 3 of them are hand holding. There's a heart with a stethoscope. There's some vague slides about whole person care and heart failure and things like that, but not really informative for how we can be helpful for you. So our goal is really to help you better understand what it is we can do. Our objectives for this talk are to understand how palliative care can help you on your cancer journey, and also help you ask your doctor for palliative care support if it's indicated and if you think it'd be helpful for you. Our talk will be broken down into 3 sections. First, what is palliative care? We'll explain that. Second, how can palliative care help support you and your quality of life? Third, when and how do you get palliative care as part of your care team? So we'll start off by answering the question, what is palliative care? According to the Academy of Hospice and Palliative Medicine, the official definition is palliative care addresses the physical, psychological, spiritual, and practical burdens of illness. It provides support to and works in partnership with your team. We recognize that patients, specifically talking about with cancer, experience more than just physical symptoms. The cancer itself, the treatment, and all the circumstances surrounding going through the serious illness. It can affect your physical well-being, your psychological well-being, your emotional state. You can have practical implications, and even spiritual concerns can arise. And that's what we really specialize in helping address and help support you through. So, how is palliative care different? We really focus on helping people do the things they love with the people they love and maintain their quality of life in any way we can. When we talk with patients and families, we often hear that the medical system seems to focus more on a narrow focus on the illness itself, the organ system. However, we really try to take a whole person approach to caring for people. So we recognize that patients with cancer have all these different needs: physical, emotional, spiritual, social, and that's why palliative care is a team-based, multidisciplinary specialty. Part of a palliative care team, you'll see patients and families are at the center, but we have physicians, social workers, chaplains, nurses, pharmacists, volunteers, supportive therapies, advanced practice providers, all in collaboration helping take care of patients with all their many different needs. We're also, we have palliative care in the hospital in the James for patients that come into the hospital. We also have outpatient services outside the hospital to see patients. And so we've talked a little bit about what palliative care is, moving on to how we can help you maintain your quality of life and feel better. One of the main things we help with is patients with cancer is helping with symptom management. Patients with cancer often have these following symptoms: pain, difficulty breathing, nausea, constipation, anxiety, depression, coping, stress, exhaustion, fatigue, low appetite, weight loss. There's a significant caregiving burden for families, for caregivers, etc. And so when we see a patient, we really try to do a comprehensive assessment and assess for all these symptoms and manage them. So just using an example of pain, which is a very common symptom for patients with cancer. Our first step is to identify what is causing the pain, and then we develop a multimodal pain plan to address that. It often includes medications to treat symptoms like pain, but our goal is always to treat the pain or the symptom effectively, but also minimizing side effects, because we know that quality of life is really the premium and what we're focused on. And if we're treating the symptom, but we're causing adverse effects, that's not really helping us achieve our goal of helping you with your quality of life. So that's why we really collaborate with our pharmacist, with our team. It can be really very helpful. We also explore non-medication treatment options. We collaborate often with other specialists who provide interventions, procedures that can help with non-medication options that might help with your pain or other symptoms and really minimize the amount of medications you're needing. In addition to addressing physical symptoms, we also consider how pain may affecting your life overall. Many patients with pain also have other emotions, worry, fear, different things come up. And so we work closely with other team members such as social workers, child life specialists, as was mentioned in the talk before ours, and other team members to really address all these concerns that come up. Many patients find faith to be an important part of coping with their cancer, and our team really includes spiritual specialists such as chaplains to help address spiritual concerns as well. So this is a slide that sort of depicts our approach. We recognize a symptom, we do a comprehensive assessment of it, we recognize that it's usually a complex inputs into it, and so we have multiple different strategies to approach and treat those symptoms. Also, we help support you in advanced healthcare planning and navigating difficult medical decisions. We collaborate with your oncologist and your other team members and help you weigh treatment options. Our goal is to facilitate communication between you and your oncologist to make sure that you receive all the information you need to make informed decisions about your care and taking into account your personal values and goals. We also can assist with completing documents such as advanced healthcare directives, which is what helps you identify a person who can help make healthcare decisions for you in the situation where you may not be able to make decisions for yourself. I'll pass it over to Dr. Scott.
Okay, so we've heard about how we help and our big team and how we really approach things. I think the question now is, does it actually work? And why would you do an extra appointment? And how we can help with those things. So as Dr. Wood was referring to, our real focus is really on improving your quality of life. Really trying to walk that journey alongside you and your oncology teams to really impact an improvement in your functional abilities, your mental health, and your overall symptom control. We have multiple studies that show that palliative care involvement also helps with fewer hospitalizations, decreasing your hospital days if you are in the hospital, and hopefully helping lessen the burden on caregivers. This was a study that was done, that was published. This is a landmark study for our field that was published back in 2008 that really looked at, does palliative care make a difference? And so we know through multiple studies that have been done over the course of the last few decades that palliative care does have an impact in terms of symptom control and improvement in quality of life. But this was really a study that showed in the New England Journal of Medicine, which is one of our primary medical journals, that that early involvement and consistent involvement in palliative care in patients with metastatic non-small lung cancer actually had an improved survival because of the improved quality of life and symptom burden that they faced. We bring that up just because I think one of the fears that we often address when patients do come to see us is the kind of synonymous and fortunate and unfortunate experience that we have of the feeling that you are coming to see hospice, which we appreciate our hospice colleagues and we value their care, but the care that we provide is very different than that. Hospice care is end of life, and as Dr. Wood was talking about, we really see patients really from the beginning of their journey all the way until the end, if that's applicable. So how and when should you ask to come and see us? So palliative care is really based on the needs of the patient, not necessarily on the prognosis. And we really want to emphasize that because I think People really feel like they have to have a terminal illness to come and see this. And often we really emphasize the serious nature of your illness, not necessarily the terminality. So this is really delivered alongside oftentimes curative intent treatment. So we have many patients, especially in our outpatient clinic, that we see for months and then they graduate, that we see for years and then they graduate, and then we have our legacy patients that we've been following for more than a decade. So oftentimes then, how do you ask for this? And would you be appropriate? That's one of the questions that people sometimes really struggle with. Is this something that really I qualify for, and what does it mean in terms of my journey? So we really believe that if you're having anything at all in terms of symptoms, struggling with any decisions, coping, or honestly, any time, you are welcome to come and see us. It doesn't have to be even that difficult. It could just be, hey, things aren't going as well as I want. My family's really struggling. I'm struggling. Can somebody else help while we navigate this? And we know that it's an extra appointment, and so we really try to decrease the burden of that as you navigate through so much and so many appointments. So then the question then is, how do I ask? And so we just gave you kind of some 3 very simple ways to ask for this. You can ask your care provider, your oncologist, your radiation oncologist, your primary care doctor. You can ask the inpatient team if you're in the hospital, would I be appropriate? Would you refer me to palliative care? I'd like to get some additional support with my pain, with my nausea, with my sleep. And I'm wondering if you think that consult would be helpful. Just to emphasize, we are a consult service, and so we work alongside all of your teams. We don't take over for them. Your primary cancer treatment still comes from all those teams that have been taking care of you. So here at Ohio State, we have an abundance of services. We have an inpatient team we have multiple teams across the James. In the university hospital settings, we also have a team over at East Hospital. We have a robust standalone outpatient clinic where we see patients with any type of cancer, but happily see any patients with any sort of GU cancer that would be referred to us. We do, usually our first visit is an in-person assessment. We want you to meet our team. We want to do an evaluation, but we do try to offer as much video visits after that as we possibly can to really keep that appointment burden at a minimum. Now, oftentimes for many of our patients, we are prescribing opioids to help with pain management, not for all, but for many. And so there is a cadence of where we do have to see you in person after that. I will say, as an outpatient palliative doc, I've been doing that now for 4 years. I would say probably one of the most common things that I hear, not necessarily after the first visit because we have to kind of prove to our patients that we can help, is patients come back and express a lot of gratitude for coming to see us, that they really see an improvement in terms of their symptoms, they see an improvement in terms of their quality of life, they feel the support of our team in navigating the medical system, and that's really what we're there to help with. So your oncologist or any healthcare provider could put in a referral to come see our team, and we are happy to see you if you need help. If you live far away and you don't want to come for an extra appointment, or you would prefer that somebody come into your home, that is not something that we do yet, but there is a kind of national database of palliative care providers, and this is the getpalliativecare.org is a way to search for that. For a referral within our system, as I said, your primary care physician, any specialist, doesn't have to be an oncologist. I just got a referral from a pulmonologist, a cardiologist. Truthfully, anybody could send you our way. Or from your hospital stay. There are many patients that we get after they've been admitted to the James and they come to see us in our outpatient clinic. Sometimes people are still learning what we are, and we still are unfortunately synonymous with hospice, and so some providers may be a little resistant of like, oh, you're not there yet. And so just be persistent if this really feels like something that you may benefit from. And we're always happy if you call our clinic to reach out to those providers on our own if you really feel like it could be helpful and you're feeling like you're getting some resistance. I will say the culture here is very positive towards our field, and so I very rarely truthfully hear that anymore. So I think the 3 takeaways that Dr. Wood and I were really hoping is that we, as a service, can be engaged at any stage of illness. Sometimes your patients are referred to us even before the biopsy results come back. And most of our patients are undergoing some curative treatment for their cancer. We help with symptoms and having larger discussions about your care, keeping you and your loved ones really at the center to make sure that we're focused on what really matters to you. And then if you really feel like you could benefit from seeing us, reaching out to your teams, asking for that help, we're very helpful to be helpful in your journey. Here are some resources for you. The getpalliativecare.org that we mentioned. There's some advanced care planning website called Prepare for Your Care, and then that's our team that's listed there. We have 20 plus physicians and around 20 nurse practitioners, 6 pharmacists, 3 social workers. We have a robust fellowship here as well with 6 fellows. So we have an APP fellow, a pharmacy resident. So we're an interdisciplinary team with interdisciplinary team training.